Namaste, I'm Dr. Kumar Swami. I'm practicing here at Sapthagiri Medical College as an associate professor or consultant in Department of Plastic Surgery. Today, I'll be speaking about what all the services we offer at Plastic Surgery Department at Sapthagiri Medical College. Plastic surgery, as most of you people know, and some people are unaware about what are the services we provide, I thought it will be a right thing to introduce to what plastic surgery and what are the services we give here. Plastic surgery, most of the cases are trauma cases, and then we also offer lymphedema cases, services for lymphedema treatment, diabetic foot ulcers treatment. We give treatment for post-onco resection reconstructions, burns. We got a big burns. We give treatment for burns also, and then for cosmetic surgery also we practice at. We give services for cosmetic surgery also at Sapthagiri Medical College. Some of the congenital deformities like syndactylies and then the cleft lip and palate, we also offer services for that. When we come to trauma, most of the trauma facial injuries like includes injury to the skin, muscles as well as the bones. For skin injuries, if there is abrasion on the skin, we can do something called as derm abrasion and then cover it with collagen. And if it is like suppose cut injury, we try to suture it with improved scarring or very minimal amount of scarring. We use micro sutures as most of the plastic surgeons use, and we'll be able to give a very good scar. Then if it is a deep abrasion or something, we try to cover it with a flap or a skin graft. And for the bones, we try to repair the fractures of the bones with reduction as well as plating. When it comes to long bone fractures, we combine with orthopedic surgeon. They fix the bones, and then if there is a wound over the fractures or something like that, we are able to cover it with a flap. We have been able to successfully salvage some of the foot injuries which would have gone for amputation by putting in free flap. And then coming to oncosurgeries, as you know, if there is a cancer of the oral cavity, the cancer surgeons usually resect the cancer tissue, and there is a big wound there. For the closure of the defect, we are equipped to cover it with a local flap or a free flap. The free flap is supposed to be a gold standard, and we are sufficiently equipped with microscopes and micro instruments, and our team are well trained to cover it with a free flap. In terms of congenital defects, where like for example a syndactyly is a disease which happens by birth where the two fingers are fused together. If there are the two fingers are fused together, we do some surgeries to separate the fingers, and then we cover it with a skin graft. And then cleft lip, where there is a defect in the lip and there is a defect in the palate by birth. The patient appearance is not good, as well as the patient will not be able to take orally well, and as well as his speech is also affected. All these things can be corrected with the cleft lip and palate surgery. Our team along with the pediatricians and the anesthetist, we are well equipped to treat these patients. And then coming to say lymphedema is like swelling of the lower limbs. This is a chronic swelling of the lower limbs where the patient has got a huge limb and the patient will not be able to move around easily. He'll have a heavy limb and he'll not be able to use his limb properly, and he'll be sometimes bedridden. He will have multiple times infection will be there, so that will be crippling his movement and all those things. Here we are able to offer him services by lymphedema therapy, which is like comprehensive decongestive lymphedema therapy, as well as reduction procedures, and as well as physiological procedures including lymph node transfers. And then diabetic foot, as you know, diabetes has become a major lifestyle disease, and most of the patients, like say more than 50% of the patients in their lifetime will have some sort of a ulcer on the foot. This ulcer, like if it goes away easily, it's fine, and sometimes it will end up in cellulitis, and then sometimes it may eat away the limb, and we'll have to amputate the limb. It can be on either extremes. So we are well equipped with a good ICU backup, and we are well equipped to treat the patient and as well as salvage the foot. If suppose there is an infection in the foot, we treat with antibiotics and then surgical debridement. If sometimes if suppose the bones are exposed, we are able to cover it with the flap and thus able to salvage the foot and then help him from going in for prevention of amputation. Then cosmetic surgeries, some of the cosmetic surgeries we are like doing here is a gynecomastia, that is male breast reduction. Then we have rhinoplasties, what we do. We have liposuctions, what we do, big bellies. And then along with that liposuction we also do abdominoplasties. And then we also equipped to do vaginoplasties and the rhinoplasties. Gynecomastia, we do both liposuction as well as excision. Most of the cases needs liposuction and excision. We have got a liposuction machine here. Hand surgeries, most of the hand surgeries we do, like tendon injuries and vascular injuries, vascular traumas and nerve injuries, tendon transfers for nerve palsies, then hand bone fracture fixations. Burns, we are well equipped to take burns which are about 40 to 50% total body surface areas. We have been successful in managing those patients and then sending back the patient home with all the burns wound healed. We are able to do skin grafts, and then we have got a mesher here. We are able to mesh the skin, and then we are able to cover a big large wound. A chronic burn wound with contractures, we are able to release the contractures, and then we are like equipped to cover with the appropriate cover with like a skin graft or a flap cover. We have been successful in managing all those patients with good amount of function after the procedure. Thank you for listening, and if there is any doubt you can come and visit the plastic surgery department at 5th floor, Sapthagiri Medical College Hospital.